I'm going to show you something that did happen on CNN with Dr. Paul Offit. He is one of the people on the FDA board that gets to vote yay or nay on COVID vaccines. And he said this to Erica Hill, and then I'm going to see if we can all find it together with just like a quick little search. Okay, so here is what he said, and then I'm going to prove to you that CNN is hiding this. Go ahead.
So the idea is there. The panel is meeting today. It's likely that they're going to recommend, right, this booster that does specifically target Omicron. So when people are trying to understand the difference, how do you explain it to them?
Well, here's what I would say. I think the question is who really benefits from another dose. I mean, the CDC has shown that people who've gotten 3 doses are generally are less likely to be hospitalized than those who got 2, and those who got 4 were less likely to be hospitalized than those who got 3. But who are those people? Who are those people who are getting hospitalized? It really falls into 3 groups. One is the elderly, meaning people over 65. 2 is people who have the kind of serious health problems, say chronic lung disease, which when they get a mild or moderate infection, lands them in the hospital. And 3 is people who are immune compromised. I think what the advisory committee is going to be voting on later this afternoon is are we going to allow distribution of the Moderna vaccine for everybody over 18, of the Pfizer vaccine for everybody over 12? And what I fear is that they're going to say everybody should get it, when in fact a healthy young person really is unlikely to benefit from a booster dose. And so I hope they target it more specifically to those really who are most likely to benefit from this additional dose.
So if they don't, because right now as it stands, if you are 50 and over, or if you have, a pre-existing condition, yes, you could be eligible, but otherwise, as you point out, younger people are not. If it is in fact authorized, Pfizer would be authorized for 12 and up, as you point out, Moderna 18 and up. Why not get it, right? If it does give you, even if it's a smaller benefit, is there any reason not to get the booster?
I think when you're asking people to get a vaccine, I think there has to be clear evidence of benefit. And we're not going to have clinical studies, obviously, before this launches, but you'd like to have at least human data. People, getting this vaccine, you see a clear and dramatic increase in neutralizing antibodies. And then at least you have a correlate of protection against BA4, BA5. Because if you don't have that, if there's not clear evidence of benefit, then it's not fair, I think, to ask people to take a risk, no matter how small. The benefit should be clear.
So if you search for this video, it happened just before Labor Day. If you search for, let's say, Paul Offit, Erica Hill, or Paul Offit on CNN, or so if you search on Google, if you search on CNN, you only find videos of him from 2021. Or really early in 2022. You really cannot find, and I put it in so many different ways. Paul Offit Omicron booster, Paul Offit CNN, Paul Offit Erica Hill, Paul Offit, I wanted to find this clip. The only way I could find it was going on Twitter.
So do you want me to, I don't know if you, I'm
Did
searching.
you find it easily?
No, not at all. I'm searching for it right now. So
okay, I would like anybody in the chat to let me know what is the search terms that you might have found
let me just, okay. So I searched for it and I found one from 2021. And when I went to go play that video, there's an issue. Now it's been removed. So CNN is actively blocking and even removing old Paul Offit videos from their own website. Should children be vaccinated? This is from 2021, this video.
But the one we just showed you, which I thought was very interesting because it is for one of the first times we hear a physician saying that we should give the vaccine to people based on who they are and their individual pathology, which has not been allowed during the pandemic up until this point. And so why is this important video that represents a shift in thinking being taken down and blocked, right? So I just want to know if you have another tab open, let me know if you were able to find this video and what are the search terms.